So robotic prostatectomy is an operation performed to remove the prostate in men who have prostate cancer. And unlike conventional keyhole surgery or traditional open surgery, robotic prostatectomy, a robotic system, is used as a tool by the surgeon to undertake the operation in a more controlled, less invasive way that allows patients faster recovery. So robotic prostatectomy is classified as major complex surgery by most hospitals around the world. But I think the key advantage of using the robotic system is that this major and complicated operation can be done quickly, safely, and with minimal trauma to patients. So the vast majority of patients can return home the day after their operation. So I think there are many advantages of robotic surgery. Clinical trials have proven fairly conclusively that robotic surgery results in lower complication rates, lower blood loss, a faster operation, and a faster recovery than conventional keyhole surgery or a traditional open operation with a big cut down the abdomen. Other advantages are thought to be as well, given the more precise nature of the surgery, quicker recovery of urinary control, perhaps improved recovery of erections. But I think these really depend on the patient and the surgeon more than the robotic system itself. In terms of disadvantages, so not every patient is suitable for robotic prostatectomy. Fortunately, in the treatment of prostate cancer, there are often more than one choice available to patients for treatment. So if the robotic surgical approach is not appropriate, there are usually other very good treatments available. So robotic surgery is performed under general anesthesia. So patients are asleep when they're having the operation, and therefore they're not aware of actually going through the surgery. Like any surgery, it can be painful when patients wake up, but the anesthetic teams we work with are very careful to make sure patients have good pain control. We'll often combine the general anesthetic with local anesthetic injections to the wounds, or perhaps even a spinal anesthetic or anesthetics around the nerves in the tummy to give an effective pain block so that when patients wake up, they're comfortable. Once this wears off, most patients are happy just using paracetamol, maybe ibuprofen if that's appropriate for them. Strong painkillers like opioids are not actually really needed once patients are back on the ward and going home. The catheter can be uncomfortable, but that's just in for about a week, sometimes 2 weeks. So most patients manage that, and they're able to put up with that until it comes out. So the key advantage of a robotic surgical operation for men with prostate cancer is the rapid recovery. This starts right after surgery. When patients are back on the ward, after a few hours of resting, they'll be able to get out of bed, stand up and have a walk around in the vast majority of cases, even in the same day as their operation. Our expectation is that patients will be fit and well to go home the day after their surgery, and they can begin their recovery at home, getting back to normal activities, family life, and eventually returning to work and other more strenuous activities. I generally tell patients to expect to take perhaps 6 weeks off work, but this depends on the type of work and also how patients recover. Many patients, I think, feel after about 3 or 4 weeks, they're really turning a corner and their energy levels and their fitness is getting back to normal. Other things like recovering the urinary control can sometimes take a bit longer to get that full control back. And we know that sexual function for some people may never recover back to normal levels. But if erections do recover, it can be a slow process. So we encourage patients to be patient and go for treatment that may help with that. And then hopefully things return to normal with time.